hypoxia, there is no problem in the partial pressure of oxygen. The problem here is low oxygen content due to low hemoglobin, either because of absolute concentration of hemoglobin or abnormal hemoglobin, such as in carboxyhemoglobin or other types of abnormal hemoglobin, such as methemoglobin, for example. So the problem in anemic hypoxia is not in the partial pressure of oxygen. It's a problem in the transport of oxygen. That's to say, if you look at the arterial blood, you will have a normal partial pressure of oxygen. The problem is that the oxygen carrying capacity is reduced. How is oxygen transported in the body? 100 ml of blood, oxygen is transported in two main forms. Actually, one form and the other is a minor form. The content of oxygen as a dissolved fraction in addition to the oxygen that is bound to hemoglobin. So oxygen is transported in arterial blood in two forms, dissolving the blood and binding to hemoglobin. Now the dissolved fraction, this is a very minor fraction. According to Henry law, the partial pressure or the content of the dissolved fraction is directly proportional to the partial pressure of oxygen. The higher the partial pressure of oxygen, the higher the dissolved fraction. But each 1 millimeters mercury is able to dissolve only 0.03 mils per 100 ml of blood. That's to say, if you have got 100 millimeters mercury, this will give you only 0.3. Only 0.3. If we compare this to the fraction that is taken by hemoglobin, normally each gram of hemoglobin, 1 gram, is able to carry 1.34. Just 1 gram is able to carry 1.3 mil per 100 ml of blood. And that's very massive. So actually, imagine what if there is no hemoglobin? You might need 600 times your normal blood to have the same concentration of oxygen in your blood. You will need tanks of blood to compensate for the loss of your hemoglobin. That's why most of your oxygen carrying capacity is because of the hemoglobin and not because of the dissolved fraction, not because of the dissolved fraction. Normal content of oxygen is around 20 ml per 100 ml of blood.